Hello, my name is Christopher Solis. I will be presenting to you my capstone research on the impact of infrastructure on mental health. Abstract. This study examines the complex interplay between infrastructure development and mental health. It identifies key negative mental health impacts associated with infrastructure projects, including increased noise pollution, displacement of homes and communities, and loss of green spaces. The research explores the mechanisms by which these factors contribute to adverse outcomes such as stress, anxiety, sleep disturbances, feelings of isolation, and depression. It emphasizes the importance of community cohesion, access to nature, and readily available mental health services in promoting well-being. Furthermore, the study investigates the role of infrastructure in facilitating access to mental health care. This includes the importance of transportation infrastructure for reaching treatment facilities and the role for digital infrastructure, particularly broadband access and enabling telehealth services. Additionally, this paper addresses the challenges faced with inpatient psychiatric facilities due to inadequate infrastructure. In conclusion, the research underscores the critical need for infrastructure planning that incorporates mental health considerations. It proposes strategies such as noise reduction measures, green space preservation, improved transportation access, and investment in modern behavioral health facilities. By implementing these measures, we can create more supportive environment that fosters the mental well-being of all individuals. Problem statement. As the older adult population ages at an unprecedented rate, the mental health of older adults emerges as critical, yet often overlooked concern. While age-related physical decline is widely recognized, the impact of the built environment on the mental health well-being remains an under-researched area. Understanding how infrastructure design influences mental health outcomes is critical or crucial for creating effective interventions and promoting a higher quality of life for this growing population. There are three research questions that guides this papers to investigate the problem. In what ways does the design and features of infrastructure influence mental health of older adults? How can specific elements of urban planning, such as green spaces and accessibility, contribute to or mitigate mental health conditions in this demographic? And how can infrastructure planning be leveraged to improve access to mental health services for older adults? Here we have the influence of infrastructure of mental health, design, and features. Things like uneven sidewalks, lack of ramps, or poorly lit streets can lead to feelings of isolation, insecurity, impacting mental well-being. Continuing, green spaces. Studies have shown that exposure to nature can reduce stress, anxiety, depression, while promoting feelings of calmness and well-being. Integrating green spaces and urban planning is crucial for providing older adults with opportunities to connect to nature and experience its restorative benefits. Accessibility. Accessible public transportation and walkable neighborhoods empower older adults to maintain independence and social connections. Limited accessibility can lead to feelings of isolation and loss of autonomy, both which can negatively impact mental health. Influence of infrastructure on mental health in our older adults, having those accessible and walkable communities. When neighborhoods are designed properly with interconnected sidewalks and well-maintained paths and accessible public transportation, this encourages our residents to get out and about, This will also increase physical activity. Of course, we know this not only benefits physical health, but also acts as a natural mood booster. When we have limited public transportation and green spaces, um, this can create a vicious cycle that negatively impact mental health, particularly in older adults. When reliable transportation, public transportation options are scarce, individuals become dependent on others or private vehicles to get around. This can significantly restrict mobility, especially for those with limited driving abilities or don't even have a car. Uh, the inability to easily reach essential services, stores, or even social activities can often lead to feelings of isolation and loneliness. All right. Telehealth, community centers, bridging the gap between mental health services and older adults requires a two-pronged approach. Telehealth infrastructure and accessible community centers. What we know about telehealth when you use the technology for remote consultation can be used for these things. This offers a convenient and stigma way for older adults to access mental health. So imagine an older adult, perhaps less comfortable with traditional therapy settings, being able to connect with their therapist in more comfortable and private way and the comfort of in their own home. This will eliminate any barriers and allows more flexible appointment scheduling, especially for those who have limited transportation. Okay, moving on to literature review. Green and blue infrastructure for mental well-being. A growing body of research highlights the positive association between nature, natural environments, and improved mental health outcomes. Right? Studies suggest exposure to uh, urban green blue infrastructure, UGBI, can contribute to mental health well-being in our older adults, reducing stress, promoting physical activity, fostering social interaction. Another key area of research involves identifying performance indicators, key performance indicators known as KPIs, specifically focus on mental health outcomes. Uh, having UGBI interventions might help evaluated based on metrics like park usage or increased physical activity. This can gauge the impact of mental health well-being that is needed to develop health-specific KPIs. This could involve incorporating surveys, generating feedback in order to use to leverage and how we can develop communities to eliminate loneliness, depression, and social and stress levels within our neighborhoods and cities, etc. Here's an illustration in a study that was conducted by Maria Andrusheli. She highlights the negative impact of urban environments on mental health in our mental health. Our inherited need for nature is well documented in research and has shown exposure to green spaces can improve mood, reduce stress, and even lessen the risk of depression and anxiety. Unfortunately, many cities lack the sufficient green spaces, creating disconnect between residents and the need for their environment provides. It goes on to say that data aims to compare access to nature across different cities and countries, specifically identifying states within the U.S. that fall short in providing these essential spaces. By pinpointing areas with limited access to nature, this data can inform urban planning efforts and help create communities that prioritize mental well-being for their residents. And this illustration depicts how other cities and countries have been able to develop and uh, significantly decrease those negative mental health outcomes based off of urban green and blue infrastructure. All right, and here's a table showing some of the benefits and what it could do for our elderly people by lowering mortality rates, slowing cognitive decline, stress reduction, decrease inflammation, social connectiveness improvement. The methodology that came through used to approach this research was multi-prong approach, comprehensively examine the impact of infrastructure, mental health, and older adults. Data collection will encompass the following methods. Comprehensively understand the connection between infrastructure and mental health in our older adults. This study will employ a multi-prong approach and in-depth interviews and discussions with mental health professional and geriatric care experts. Additionally, through review of relevant literature and from these fields will be undertaken. This combined approach aims to illuminate the key challenges faced for older adults and identify potential solutions and critical intersection of infrastructure and mental well-being in our older adults. Findings discussion had an opportunity to interview a licensed clinical social worker, Christine Castañedas, with over 15 years of experience. She definitely shed some light on the connection between access to nature and mental health well-being during our interview. Ms. Castañeda strongly believes that having access to green spaces can improve mood and overall health. She further elaborated on the significant challenge faced by many older adults, limited transportation options. She goes on to say that a lot of folks will prioritize their health care, their physical health versus their mental health at the expense of their mental health, but lack of transportation. However, Ms. Castañeda also offered an array of hope and potential solutions. She underscores the importance of educating and encouraging healthcare providers to better support telehealth needs. This could involve equipping care providers with the knowledge and resources to help their patients, particularly older adults, utilizing telehealth platforms for mental health services, including cognitive therapies. Telehealth offers a valuable solution overcoming geographical barriers and limited mobility. Policy implications. The United States has a unique opportunity to address the needs of its growing aging population by implementing a multi-pronged approach in infrastructure green space development. By prioritizing improvements of directly enhanced mobility, social interaction within our adults, using things for grants for sidewalk repair and construction, ensuring that they're smooth, well-maintained surface, proper signage and crosswalks can help reduce the feelings of isolation. Furthermore, we talk about by placing essential services, grocery stores, social hubs within walking distance of residents, older adults can maintain independence and sense of community with limited mobility. Finally, we look at implementing comprehensive policies in the U.S. can transform its communities into havens of accessibility, social connection, nature, fostering and thriving, well-supported aging population. In conclusion, the connection between infrastructure and mental health in older adults is a powerful call of action. By prioritizing urban green and blue infrastructure, accessibility, and evidence-based design, we can revolutionize communities into havens of well-being and of our aging population. This not only fosters mental health, but it reduces health disparities, but also it creates a blueprint of age-friendly environments across our nation. While further research is crucial to optimize the BI design and measure to its impact, the potential for positive changes is undeniable. Let's harness the power of infrastructure to build communities and nature, not just nurture our bodies, but also our minds and spirits for our most cherished generation. Questions? Thank you.